Discover how bone marrow transplants save lives and restore hope. Bone marrow is the soft tissue inside our bones where blood cells are made. A bone marrow transplant replaces damaged or diseased cells with healthy ones, restoring blood and immune function. There are two main types: autologous, using your cells, and allogeneic, using cells from a donor. BMT is often used for serious blood conditions like leukemia, lymphoma, and certain cancers. The process includes preparation, transplant, and a careful recovery phase to ensure the new cells take hold. After transplant, patients are closely monitored to prevent complications like infection or rejection. Even if a perfect donor isn't available, options like half-matched, haploidentical transplants can be life-saving. At Viezec, we offer expert care, global donor access, and end-to-end support for transplant patients. Bone marrow transplant is more than a treatment, it's a second chance at life.